Antimicrobial stewardship is vitally important because we have noticed that antimicrobial resistance is increasing in both the human and veterinary populations. And so we need to make sure that we're safeguarding our antibiotics so that we can continue to use them. And antimicrobial stewardship programs are vital in that mission. The American Veterinary Medical Association created core principles to help with the establishment of antimicrobial stewardship programs. And they are first, commitment to stewardship. Advocate for a system of care to prevent common diseases, select and use antimicrobials judiciously, evaluate antimicrobial use practices, and to educate and build expertise.
It's critically important that leadership is on board and they walk the talk and they invest the necessary financial and human resources to make sure that an antimicrobial stewardship program is successful. And that means to help minimize antimicrobial resistance in both humans and animals, and compliance with everybody involved is critical.
It's vitally important that we have leadership on board so that they can set the tone for the hospital to understand that antimicrobial stewardship is important in order for us to safeguard our antimicrobials. We need to also make sure that everyone from the veterinarians and the entire staff is on board with this as well, to make sure that we are implementing and are compliant with antimicrobial stewardship so that it can actually work.
The goal of an infection control and prevention program is to help prevent the spread of infectious diseases. When we talk about that in conjunction with antimicrobial stewardship, they're like best friends, because when we have less disease, we use less antibiotics. And down the road, that will help prevent the onset of antibiotic resistance. The best way that we can prevent the spread of infectious diseases is by practicing hand hygiene. That is the #1 way that we can prevent the spread of those diseases.
We also use active surveillance of our hospital environment to identify risks to our patients and do things to help mitigate those risks and keep our patients safe.
As a microbiologist, if we talk about how to ensure we are using antimicrobials judiciously, I will say we need to focus in 3 different things. #1, be familiarized with the site of infection and the most common pathogens that cause infection in that body site. But it's also important to get familiarized of what is potentially normal microbiota, because we don't want to treat those. Secondly, be familiarized with antimicrobial use guidelines. These antimicrobial use guidelines can be designed by your own institution, but we also have international guidelines like the one produced by the International Society for Companion Animal Infectious Diseases. And actually here in OSU, we also have some great antimicrobial use guidelines that now are publicly available for everybody to use. And the last thing I will say is to use culture and susceptibility when you have tried empirical use of antimicrobials and you are not resolving or you are not having a proper clinical outcome in your patient.
So as an epidemiologist, I know the importance of using surveillance as part of our antimicrobial stewardship program. We use passive surveillance to monitor the resistance of diagnostic pathogens we recover from patients. This helps us determine what are the best treatments for our patients.
We need to know what kind of antibiotics we're using, if it's following best practices for antimicrobial use, if we're using the right antimicrobials for different disease processes. So we need to make sure that we're monitoring that so that we could see if there's any concerning trends or positive trends that we need to celebrate.
As a pharmacist, it's important to monitor antimicrobial uses in veterinary medicine because it will help us identify emerging resistance patterns in bacteria and also help us to see how we're using our antibiotics for certain pathogens. When it comes to challenges with surveillance in antimicrobial use data in veterinary medicine, our biggest challenges are assessing use as a consumption, and that means as selling as a whole, so that antibiotic class and how much we use as a whole versus patient-specific usage and identifying it, is it appropriate for that disease and that dose that the patient is receiving.
Educational content for veterinarians regarding antimicrobial stewardship is in hot demand right now. Veterinarians want to do good. They want to know how they can help their patients. They know that antimicrobial resistance is a huge problem in veterinary medicine and in human medicine. They know how important stewardship is in order to combat the problem of antimicrobial resistance. But they need to know the practical information, the practical know-how to get those types of stewardship practices implemented in their clinics. And coupled with these programs are environmental surveillance, looking at antibiograms to see what type of resistance profiles we're seeing in our clinical cases. We will do antimicrobial use guidelines to help direct and guide in empirical treatment choices.
So antimicrobial stewardships provide guidance and guidelines of active steps that veterinarians, the veterinary medicine in general, can apply to protect the future efficacy of antimicrobial drugs. With your help, we can keep antibiotics useful for both animals and humans.